From CareCredit, it's Care Experts, a podcast where we dive deep into the health and pet care industry with the professionals that make it happen. I'm Antonio Diaz, and this is Logan. If you have a short-headed dog or cat, think French Bulldogs, pugs, or Persians, you probably already know that they're adorable, quirky, and, well, a little high maintenance. And if you were considering adopting one, now you know. Brachycephalic breeds are more prone to breathing issues, overheating, and other health challenges that require extra care. That's why we're sitting down with Dr. Matthew Wheaton, an experienced veterinarian and the chief of staff at Alicia Pet Care Center. He's spent years treating and advocating for brachycephalic pets, helping parents understand how to give their special breeds the best quality of life. In this episode, we'll break down the most common health issues these pets face, how to manage them, and what you can do to help your brachy pet breathe easier, stay active, and live a comfortable life. Dr. Wheaton, welcome. I'm so happy to have you here. Before we jump into anything, I have to just get this off my chest. Brachycephalic.
Exactly.
Am I right?
Very good.
How have you heard it pronounced? I'm just curious.
I think 15 minutes ago, I heard someone say brachycephalic.
Brachycephalic. Okay.
There's no O in there.
All right.
Brachycephalic.
Okay.
People just word salad it.
Yeah. I think people just avoid saying the word and say smush face dog. I hear that a lot.
Snub nose breed.
Yeah. I call them wall pushers. Yeah. Not to offend anybody, because we already know, we're talking about some Frenchies and pugs and things like that. But
cutest.
Before we jump into the topic, I do have a little game I want to play. And we're going to call this one Fact or Far-Fetched. So let's jump into it. This is a little icebreaker game.
Ready.
All right, let's do it. All flat-faced cats snore when they sleep.
I'd say fact-ish.
Okay.
Because the whole snub nose setup just creates a longer, soft palate.
Okay.
So most of those cats are going to snore. Not all of them, but most of them are going to snore.
Will that apply to dogs as well?
Yes.
Okay. Another one. French Bulldogs were originally bred as rat hunters.
So that's kind of true. They actually were bred as coming out of English Bulldogs, and they were companions in lace factories. And in the lace factory, there were a lot of rat problems, so they were companions and also working to keep the rodent population down.
Okay. But we're also talking about a different look of a French Bulldog.
Yes.
Not the same French Bulldogs that we see today.
No, they've definitely been highly refined to what we currently have.
Okay. All right. Brachycephalic pets can't fly on planes.
That's mostly true, primarily because it's really difficult for dogs to actually get approved to fly on planes in cargo. But if they're coming along with the owner in the seat, that's not a problem. There's no breed limitations if you're bringing your dog with you. Usually those dogs are less than 20 pounds, so they can travel with you in the seat.
Gotcha. Is it more so because the cabin is pressurized, so there's no issue?
And temperature controlled.
Okay.
That's the biggest thing. It's
Gotcha.
like you don't want them overheating down in the luggage compartment.
Makes sense. Brachycephalic dogs have a stronger sense of smell than other breeds.
Definitely far-fetched on that one.
Okay.
They have way less nasal tissue, and so their whole olfactory system is kind of messed up a little bit.
Okay. Brachycephalic dogs shouldn't swim.
That's probably also true.
Okay.
Because they have a hard time breathing in general. So you don't probably want to pour water down their throat and have them have that additional consequence and have a hard time breathing.
Gotcha. With that said, what makes a breed brachycephalic?
So it is that snub nose breed. So brachycephalic basically means short head. And that is going to be an appearance basically of that dog look like it actually ran into a wall. And it takes all of those head parts, so mouth and nose, and makes them shoved into a smaller compartment. All of those tissues inside are generally just as big as the dog who has a normal size nose. So it's just a lot of crowding of soft tissues in there. There's a lot of dental problems as well because there's a lot of crowding too there. Yeah. But it's primarily the soft tissues in the back of the throat that's the issue.
Okay. Do you know why a dog would be bred to look like that? Is it purely aesthetics, or was there any purpose for that at some point in time?
So we go back a few centuries here, and I'm not exactly sure like what the impetus was to breed those
Yeah.
dogs that way, but they are very cute, and cute dogs are very important for people. So I think that primarily right now is what's driving the popularity of these breeds.
Okay. What do you think are the more common breeds that you see that are brachycephalic?
So French Bulldog is the number one breed that we see that's
Winner.
brachycephalic. Yes, it is the top breed in the U.S. for 3 years running now.
Okay.
But English Bulldogs, pugs, Boston Terriers, those are the primary ones that we see a lot of.
There's a lot of problems, obviously, that can come with having a Frenchie, but there are definitely some benefits. I mean, they seem like great dogs. What are your thoughts on the reasons why people continue to get them? It seems like conflicting situation.
It's a really good point. This is the most popular breed for lots of reasons. These dogs are super fun, high energy, very, very cute, great family pets, loyal, intelligent. Like they've got this incredible package of personality that comes with them that overrides a lot of the negative consequences.
What are the most common health issues that these breeds deal with or face?
So the biggest thing is just based on their anatomy.
Okay.
That shoving of all that soft tissue into a smaller space creates potentially the BOAS, but the brachycephalic airway obstruction
Okay.
syndrome. So that is a very bad problem for them. They can't really breathe necessarily all the time. You hear a lot of snoring when they're having, kind of an excited breathing moment.
Yeah.
And these dogs can overheat and they can collapse from not getting enough oxygen. They do frequently have long-term problems associated with that anatomic setup. They have lots of additional issues as well, just due to their refined genetics.
How would a pet parent know that their dog has BOAS?
Sounds are the primary thing. It's not normal for a dog to breathe in that way. That's just not a normal thing. And so those are the dogs that would absolutely be good candidates for intervention.
Okay.
I think it's just a simple question. If you have a brachycephalic dog, you should be checking in with your trusted veterinarian to give you advice on what to do. If the dog is getting spayed or neutered, as many dogs end up doing, that's a really good opportunity to at least do the nose work, because the nose work is very, very simple.
Okay.
Then you're talking to your vet about, what can I do? Is this a good candidate for surgery? Because the surgery does also carry with it some potential for negative consequence. Not every single dog does great with that surgery. There are some possible complications with the surgery. That's why you want someone doing it that is very experienced and can support the dog afterwards, because the recovery is important.
Yeah. You mentioned earlier about a smaller soft palate.
So they have a long, soft palate, too
soft
long.
palate, excuse me.
So the elongated soft palate is just because they don't have enough space in there, and so it drips over their airway opening and causes a lot of sounds. But the sounds are coming from a partial obstruction, and that can worsen over time, because as the dog is struggling to breathe, it's actually truly stretching that soft tissue out, and so these problems do typically progress over time.
Okay. Now, you mentioned too that there's a lot of crowding in the mouth. So have you ever had to remove teeth, or would you recommend that if there's a lot of crowding in the mouth?
Usually it just leads to more pronounced dental disease, because the crowding will just create additional places for tartar to adhere to the tooth and cause more periodontal disease.
Okay.
So they just struggle more with that kind of thing. They also have typically very small nasal openings, so that is a big problem for them as well. The stenotic nares is what that's called.
Okay.
And then they can't really breathe either way. They're having a hard time breathing with their mouth. They're having a hard time breathing with their nose. That's a really big challenge for them.
What would you recommend for a pet owner that has, let's say, a French Bulldog that in the summer months shouldn't be outside, really shouldn't be exerting themselves? But yet, from my personal experience working with Frenchies, they are extremely energetic and they have a tenacity that is unlike a lot of other breeds. How do you recommend for your patients to deal with that, keeping the dog safe, but also, giving them a quality of life and fulfilling that desire to be rambunctious?
It's kind of the conundrum of having a French Bulldog, to be
Agreed.
honest with
Yeah.
you, is that, oftentimes you get a dog that has this high drive, very, very energetic dog that can't really actually do what it needs to do. And then it's limited to exercising. It has to be kind of in a cool, this is one of the recommendations, keep the dog cool, because they, manage their temperature with panting, and they can't really pant necessarily very well when they want to pant. Now they're struggling to breathe and they can't cool themselves down, and then they can have heat stroke. So keeping them cool is really important. There are things that we can do surgically, and that, maybe seems extreme, but a lot of these dogs actually really do have a life-changing event with a surgical approach to this. So some of it's really easy. The stenotic nair surgery is really, really simple. Almost every veterinarian can do that.
Okay.
The soft tissue adjustment in the back of their throat, that's more of a specialist, or at my practice, I have a doctor, Dr. Feinart, who is really, really good at these. He's done hundreds of them, and that's because we have a laser surgical unit at our practice, and it allows for us to actually do this job really well.
Very cool. Now, would you recommend if someone has a brachycephalic dog to get surgery? Like, is that sort of a standard practice for you, in your opinion, or is it more like an elective surgery, something that if things get bad or worst case scenario, you opt for the surgery?
It depends. It depends on how severe the dog is. So that's a spectrum disorder, because there's different variants of anatomy.
Understood.
But the dog that's really struggling, that can't really do the normal thing in life, it can't exercise, I mean, that would be a good one to have a consultation with a veterinarian about the pros and cons of doing that surgery.
Okay.
But if you open the airway up of a French Bulldog, immediately you have a completely different dog. That dog now can exercise as it normally is supposed to do, and not have difficulty breathing, and not have this progressive challenge through the rest of its life.
Okay. You mentioned earlier brachycephalic obstructive airway syndrome.
Yes.
BOAS, right?
Yes.
What exactly is that? And does every dog have that who's brachycephalic, or is it like, again, it's kind of on a spectrum?
Yes, it's on a spectrum, because some of the dogs, occasionally we'll get a dog that actually doesn't struggle all that much. It doesn't snore when it's, sleeping. It doesn't snore when it's awake. It doesn't really have any big problems. It can exercise well. Those dogs are relatively unique in that batch of breeds. But most of them are kind of in the moderate severity.
Yeah.
There are some severe dogs that you can tell, like I can't walk my dog down the street half a block before it's
Yeah.
that kind of thing is just not a way to live. So,
I agree.
those are dogs that would definitely benefit from getting a surgical approach.
Gotcha. What would be a determining factor for you if a patient said that their dog snores? How would they be able to tell the difference between, let's say, regular, normal snoring versus snoring that should be a concern for them?
I mean, to be honest with you, most dogs don't have normal snoring. So I think
fair enough.
snoring at all is probably, one step in the wrong direction. But if they came in and they said, my dog snores at home, and if it's been going on for a long period of time, then we don't have a concern about a new problem coming up. But if the dog was actually really having a problem that was actionable, they would be showing it in the exam room. They would be not able to breathe on a regular basis. Those would be the dogs that we really want to impact with the surgery.
Okay. And with the surgery, what's the recovery process look like? Is it daunting for the owner? They have to prevent?
Not really.
Okay.
It's pretty simple. Once we get past the 36-hour post-op period, then it's all about just not irritating the back of the throat like a kid that had tonsils out.
I see.
You don't want to be eating a lot of sharp items during that healing process, so you don't mess up the surgery, make it start to bleed. Most of these are done with laser, so there's not a lot of suture material in the back of the throat typically. But, with that, we also don't have the suture holding things together, so we don't want to have really sharp items. We'll always be doing a soft food for like 2 to 3 weeks with healing.
Now, we speak with a lot of veterinarians, and it's a typical suggestion to have dental work done every 6 months. In a lot of cases, in fact, the dog has to go under anesthesia. Is that going to be an issue for a dog that's brachycephalic?
It can be, and the approach to the brachycephalic dog, as far as anesthesia goes, is definitely should be very different, at least.
Okay.
At our practice, we have a very specific protocol for dealing with the brachycephalic anesthesia patient. pre-oxygenating them so that they start off in a benefit basically with oxygen, and actually keeping the endotracheal tube in for a longer period of time so that they're really awake when you're taking that tube out so that they can swallow on their own and they don't have a problem there. But they frequently will regurgitate as well. So that's a whole nother thing that the brachycephalic dog frequently has, is that they kind of pull their stomach up into their chest a little bit, and that can make it so that they're more likely to regurgitate. That problem is not good to have happen when you're dealing with an anesthetic dog, because they can sometimes regurgitate and then aspirate that fluid down into their lungs, which we definitely do not want. So we typically use medications to prevent that kind of thing.
Okay. What medications would you typically use for that?
Well, so when we're doing a surgery, we're giving injectable treatments that are either decreasing the acid in the stomach or decreasing the vomiting risk.
Okay.
So those kind of things really help soothe that situation out. At home, oftentimes we do have chronic regurgitation issues with some of our brachycephalic dogs, and there are medications that we can use that can help with that on a long-term basis.
Okay. And those issues, are they directly related to like heavy breathing? Is that what actually causes them?
It's more the anatomy associated with that dog, but oftentimes it is kind of combined with that, because those dogs, when they're having a hard time getting the air through their throat, they will increase their pressure in their lungs, which not only stretches tissues down, but it kind of pulls everything towards the lungs. And then if you're doing that with the stomach, you're kind of kinking things off and making it more likely that you're going to have problems with regurgitation.
Gotcha. And at home, if somebody is trying to reduce the stress of a dog in terms of breathing, are there any recommendations that you would give? Like you mentioned, for example, you give them oxygen in the office. Is it possible for someone to give their dog oxygen, or maybe like a breathing treatment to aid in their ability to breathe, or at least take in more oxygen?
It's kind of all about keeping them calm, to be honest with you, because if they are calm, they will not breathe as hard. It's not really very feasible for people to run oxygen on their dogs at home.
Yeah.
We do have some situations where we can use canisters for transportation to an emergency hospital or something like that if a patient was actually really set up for having a problem like that.
Okay.
But that would be the big red flag, that like if you're in that situation at home, you really should be talking to your doctor about a referral for a surgical consult.
Gotcha. Yeah, I was thinking more along the lines, because I have a niece who has asthma, so she has like breathing treatments where she has this machine set up, and it's I forget
Nebulizer.
Yes, thank you, the nebulizer. So that's kind of what I was envisioning. Is anything like that practical for a dog?
Not very helpful, because your nebulizer is going to be helping in the lungs, and the lungs are generally not the problem. Once the air gets to the lungs, the dog is relatively a normal dog, just like anybody else. But it's the problem of getting the air to the lungs that's the issue for those dogs.
Okay. Now, I'm a dog guy, but from what I understand, this issue affects cats as well.
It can, yeah.
There are certain breeds of cats that are prone to being brachycephalic.
Persians and Himalayans primarily.
Okay. Yeah. And is the treatment for them the same for dogs?
They don't tend, luckily, they don't tend to have nearly as bad a problem as the dogs do. Okay. One big reason for that is cats tend to lay around a lot. They're not usually very active in the home.
Okay.
But and those cats are also bred to basically be lap cats. So they're typically gonna have such a low exercise lifestyle that they don't generally push the issue a lot. The issue with the kitties most of the time really is just snoring. That's kind of the biggest problem that we generally will run into.
Okay. What would you recommend for anybody that wants to exercise their dog but not overexert them because of their brachycephalic condition?
So the big thing is just, you're choosing the time of day and the season that is going to set the dog up for success. So you're not in the summertime going on a 3-mile hike with your dog in the middle of the day. Yeah. That's, recipe for disaster.
Yeah, I would also add to that too, if there's any way that we could provide mental stimulation for a dog, something like snuffle mats, or even like a little sniff game where you hide treats around the house and just get them to activate their mind versus, a lot of people think exercise, it's always physical, and it doesn't always have to be. I think, puzzle games or just a way for a dog to engage their own mind with regard to sniffing and just exploration would be a great way as well. In your experience, do you find that pet parents are aware of the benefits of mental stimulation, or mental stimulation on its own, like that it exists?
So I totally agree with you. That is such a important part of getting a dog environmental enrichment and also tiring them out. They're going to be way more tired if you actually work with their brain than if you work
Yes.
with their body. Dogs
Agreed.
are meant to go miles and miles. So
Yeah.
you can't really get the same kind of effect. It's like a kid going to school versus a kid going to the playground.
Mm-hmm.
That kid going to school is going to come back. They're going to be really, really tired at the
Yeah.
end of the day because their brain is doing the work.
I
So as
agree.
much as you can engage with the dog's brain, it's going to tire them out. And that is a great substitute for, actual physical exercise.
Yeah. I often tell my clients that if they were, I say to them, I go, have you ever read a calculus book? And I'm like, read 30 minutes of a calculus book and then tell me how you feel after that if you want to do anything. And, when we're working our mind to that degree, we can be mentally exhausted. And that mental exhaustion actually makes us physically exhausted. Like we don't want to get up because we're our brain is fried. So
Sure.
I think mental stimulation is in my opinion and experience, a very overlooked aspect of a fulfillment process that we can provide our dogs that aren't directly related to taking them on walks, throwing a ball, or having them run around with the zoomies all day long.
Yeah. Nose work is really,
Oh,
very
yeah,
instinctive, right?
exactly. Yeah.
You teach a dog how to go and find the treats and the hidden places. That's what a dog is set up to do in
Yeah.
that regard. So it really taps into one of their strengths and is a great mental stimulant for them to, kind of get some enrichment, but also tire them out.
And even I would say hide and seek. If you got kids, have the Frenchie go find the kids in the closet or in the backyard or something like that.
Yeah.
With regard to heat stroke, are brachycephalic dogs more prone to that in your experience?
Significant.
Yeah.
The poster child for this is the fat bulldog.
Oh, yeah.
Okay, so obesity is, again, one of these things that is a
Yep.
problem for this breed because they can't exercise very well. We love them so much. They're obviously adorable. So we give them lots of treats or extra food. They can't really burn off the calories. Now we have a, 10, 15 pound overweight bulldog that is now extra struggling. They've got this layer of fat on their chest as well that makes it more hard for them to breathe. Those dogs are the poster children for actual heat stroke, collapse. Some of these dogs do end up dying. It's very, very scary when you get to that situation because it's like you got to go and do something about this right away if you get to that point.
Yeah, and correct me if I'm wrong, but what I understand about heat stroke is that if a dog is suffering from a heat stroke or at least early signs of it, one of the last things you should do is pour like ice cold water on them. You should slowly bring their temperature down because they can go into shock.
Exactly right. You shift everything in the wrong direction cardiovascularly, and it just counterproductive.
With regard to short-faced dogs, do you recommend always from a medical perspective for the dog to be in a harness versus like a collar or slip leash?
Definitely. Harness is critical. You don't really want to put extra pressure on their throat because it doesn't take very much to actually, you can try it on yourself. You put a little pressure here, suddenly you can't breathe. You don't want to add any additional challenge for those dogs to be able to breathe.
So Frenchies and Bulldogs tend to have really like wrinkly faces with a lot of folds. Do you have any tips or recommendations on how people should go about cleaning those folds and wrinkles?
So I think just staying ahead of it, you don't have to necessarily do any products.
Okay.
If you're doing it on a daily basis, you're really just kind of trying to wipe the moisture from that area so that it doesn't build up and create inflammation, a skin infection, etc. But the consistent moisture there, that's what that's all about, is the skin fold is going to create a moist environment, and that moist environment is going to allow for bacteria to grow more readily. Oftentimes we don't recognize it early enough. We don't have the habit in place, and then you get a little bit of dermatitis in the skin fold. That's when you kind of have to now start pulling out products to actually fix the problem. So there's several different things that are on the market that are basically disinfectants and kind of drying agents.
Okay.
Hydrogen peroxide would probably be the last thing that I would use because despite it bubbling up and looking really cool, it seems like you're doing something good.
Yeah,
it
does.
is very bad because it kills rapidly or baby epithelial cells, basically, that are trying to kind of heal the process. And so it delays wound healing. It's not probably the best thing to use. So just a mild antibacterial solution of some sort would be helpful in that situation.
Okay. Yeah, I heard something similar where basically hydrogen peroxide cleans good and bad bacteria. So it's not necessarily the best thing to use when it comes to like cleaning a wound or even cleaning the face of a dog for that matter.
I mean, it'll kill bacteria, but you're also killing the good stuff too. So there's a negative consequence there.
Well, I want to jump into our Ask Me Anything section. We have some questions lined up from our audience that they would love to hear. So, are there any specific toys or chews that are better for brachycephalic breeds, and specifically before and after an airway surgery?
So after the airway surgery, we'll start there. You
Okay.
really don't want to have anything that's sharp going into that dog's throat. And that would include even like bully sticks, which are really, popular chew toy.
I've recommended them.
Yeah, I think bully sticks are not bad, but they can get kind of hard in the back of the throat, and oftentimes these bully breeds, they'll go ham on this stuff, and
Yes.
all of a sudden, like, you're swallowing the big thing. You don't want any of that because you don't want to traumatize the surgical area.
Okay.
I think beforehand, you kind of have to gauge it and see what happens. But one of the things that sometimes happens when you're using a kind of animal-based chew toy is that the dog is really excited about it, and you get into a lot of physiologic changes. Suddenly, this dog's mouth is filling up with saliva.
Yep.
It's chewing on the thing. It's not swallowing its saliva. Now it has basically all this additional fluid in its mouth that's causing additional challenges for the dog to breathe against. So those kind of things don't necessarily work very well for those breeds.
Yeah.
Sometimes just using, sort of non-animal chew toys, things that I think you and I would agree upon are toys that actually spit out little treats that they can work with. That's also stimulating their brain, puzzle toy kind of things. Those are really, really helpful before surgery. I think those would be completely fine.
What are your thoughts on like a stuffed Kong?
I think a stuffed Kong is great. The stuffed Kong is an excellent item. And that would even be okay, I think, post-operatively.
Yeah.
Because oftentimes they're frozen, but they're going to defrost relatively quickly. And most of the time, the dog is just going to kind of lick, 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 lick.
Yeah.
So that's not really a bad thing for a dog to do.
All right. I love it. I love the insight too, because a lot of this stuff, and this is why I love this show, because there's a really big disconnect between training behavior and like the medical aspect of dogs. And even some of the things I'm getting from you today, I can't wait to share with clients with regard to, brachycephalic breeds, because these are things I didn't know. Like I had no idea that, post surgery, for sure, we need to stay away from something like a bully stick. But even it sounds like a strong recommendation to stay away from it even prior to, like, no need to aggravate that area if we don't have to.
True.
So yeah, I really love the information. All right, next question. I feel like my French Bulldog has terrible gas, and a lot of it. It's basically become a personality trait of my dog. Is that normal in this breed of dog, or is it just my dog? Before you answer that, I want to say that I feel like this was a client of mine because I swear I meet a lot of bulldogs and French bulldogs. But yeah, personally, if I would chime in on this, I think it's a food issue. But I'll let you. You're the expert. I want to hear what your thoughts on this.
Okay, so I think it's two things. One, I do agree with you on the food issue, but it's kind of more about like these dogs oftentimes are set up for having intestinal problems. And, some of that's genetic baggage that goes along with their, finely tuned breeds, but they have a predisposition for having inflammatory bowel disease, both Frenchies and regular bulldogs. Pugs and Bostons, not so much, but the bulldogs definitely have that predisposition. Then that's going to cause, a dog that be hyperreactive to particular diets and potentially ongoing gastrointestinal issues.
Gotcha.
That's going to make some gas. But the other thing that's going to make a lot of gas is they frequently will swallow a lot of air when they're eating. These dogs will gulp down air. They're having a hard time actually breathing properly. And so they'll swallow it into their gastrointestinal tract, create a lot of extra gas for them to deal with, and that's going to go down the pipe and come out the other end.
Okay. Yeah, they definitely gulp a lot. All right, next question. My Frenchie gets so excited when I come home. She literally launches herself into the air like a solid 4 feet. I've heard she can be prone to hip issues, so should I be worried? And is there anything I can do to keep her from hurting herself?
That's a really real issue because a lot of these dogs do end up on couches and beds and launch themselves off with reckless abandon. That's very typical of dogs to do that, even if they're kind of having a hard time getting up. So I think the hip's a valid concern. So, again, it goes into the genetic baggage thing, predisposition for hip dysplasia on pretty much all of those dogs. But with a Frenchie, we have this whole other thing. They're really, really prone to having spinal disorders. So they have a lot of deformities of their spine. The vast majority of French bulldogs, if you take an x-ray of them, you'll find all these weird spinal abnormalities, hemivertebrae, and all these weird things. They are very prone to having back problems, and you don't really want your dog launching itself off and having this impact situation where it now is challenging an already challenged area and then potentially slipping a disc or causing some other kind of trauma to the back. I think that would be my bigger concern. But yes, definitely a valid concern.
Yeah, I really, really appreciate the insight. And I've learned some things today that I can't wait to share with my clients the next time I run into a brachycephalic dog, particularly bulldogs and Frenchies. So thank you so much for your time. Really, really honored to talk to you.
It was great. I love it. Thank you.
Whoa, whoa, whoa. Don't leave yet. I just want to say, if you want to hear more about health and pet care, check out these episodes of Care Experts. Also, before you go, make sure you hit that like and subscribe button. New episodes drop every Wednesday. You don't want to miss it.